It is now time for oral questions. I recognize the Leader of His Majesty's Loyal Opposition.
Speaker, good morning. Yesterday, we kicked off National Nursing Week. Doesn't it say so much that just yesterday this Conservative government passed a law that's going to sell off our healthcare system to corporations who can make money off the backs of sick people? And I want to remind everyone here, this is something that the nurses of this province deeply oppose. The Conservatives are going down a path that both Quebec and British Columbia already found was a dead end. It cost everyone more. The government, individual patients, it worsened health outcomes, and in the end, it made it harder as well on healthcare workers. Speaker, to the Premier, will you stop the hemorrhaging of nurses out of our public healthcare system when there was nothing in the legislation to prevent it?
To reply, the Deputy Premier, Minister of Health.
You know, Speaker, with the greatest of respect, the NDP could not be more wrong about Bill 60. I will highlight what the Auditor General's report on outpatient surgeries in Ontario emphasized, that the experience in other Canadian jurisdictions that community surgical centres can treat 20 to 30% more patients within the same amount of time. Why are other Canadian jurisdictions doing it, and why is Ontario doing it more? Because we want people to get access to surgery and not sit in wait lines. Thank you.
The supplementary question.
You know, this is how out of touch this government is. If they actually got out of the back rooms and talked to the people on the front line, the nurses, the healthcare workers, they'd know the mess that they have created already in healthcare staffing. Ontario's nurses have been chronically overworked, underpaid, and undermined by this Conservative government. And now, Speaker, nurses are currently without a contract. This week, we're going to be tabling petitions with thousands of signatures calling on this government to present a fair and meaningful offer to their negotiations. Speaker, to the Premier, will his government give Ontario's nurses a contract that shows how much we value them?
Minister of Health.
Thank you, Speaker. There is no doubt that we, in this side of the House, understand the very valuable, important role that nurses play in our healthcare system, which is, frankly, exactly why, at the beginning of the pandemic, we initiated a Learn and Stay program under the leadership of the College of Nurses Ministry. It allows nurses who want to practice in the province of Ontario and train in the province of Ontario to have their tuition and their books covered if they are willing to practice in an underserviced area for 2 years after graduation. What did that one program do? It ensured that we had the highest number of students applying for those programs. There are many, many people who want to practice in their communities, in healthcare, and we're going to enable that through our legislation. Thank you, Speaker.
Final supplementary.
Speaker, they are leaving Ontario. You cannot recruit into a broken program. With all of their efforts, we're going to be 33,000 nurses and PSWs short in this province, and that's a fact. Speaker, that response does not give me a lot of hope, because while this government says one thing in this House, they say quite another thing to Ontario's nurses, and their actions speak louder than their words. This government continues to take our nurses to court. It's a fact. They're fighting with them and with other public sector workers over their unconstitutional wage restraint law. Speaker, to the Premier, will he celebrate National Nursing Week by ending his campaign to take Ontario's nurses to court?
Members will please take their seats. Minister of Health.
Another thing that we did when we came back after a larger majority victory in June was, in fact, talk to and work with our partners at the College of Nurses of Ontario. And we said, we have far too many internationally educated and trained nurses waiting in the queue to come and practice in our communities. Would you work with us to ensure that those individuals who are waiting at the College's nurses for assessment get that assessment, review, and ultimately approved license faster? What did that do, Speaker? It meant that we had the historic high of new internationally educated nurses practicing again in our communities, in our hospitals, is in our ability to ensure that whether it is new nurses being trained, internationally educated nurses who want to come to Ontario, we are doing the work here. Thank you, Speaker.
Next question, Leader of the Opposition.
Speaker, Ontarians are waking up today to news that expanded for-profit private health care is now the law of the land. And in rural and northern communities, they are rightly worried about the impact that two-tier health care is going to have on already strained hospitals and community health centres. I was in Thunder Bay last week, and like many communities across the north, they're worried that the local hospitals that they proudly support and rely on are going to be closing their doors as staff are forced out by low wages and private sector competition in the south. Speaker, to the Premier, why is this government putting private profits ahead of the needs of patients in the north?
Minister of Health.
Thank you, Speaker. I want to remind members opposite that, in fact, we have over 900 community diagnostic operating rooms operating in the province of Ontario right now. What are we doing through Bill 60? We are ensuring that your constituents who are waiting in line, who are waiting for scheduled surgeries, have the opportunity to get that faster. We did it at the beginning of the year by announcing 3 expanded cataract surgeries in Windsor, in Kitchener-Waterloo, and in Ottawa. That means that people are back with their families, back on the job, back in community, where they want to be. They don't want to be on a wait list. And we're expanding because we want to make sure that your constituents have the ability to get access to the health care they deserve in community faster. Thank you, Speaker.
And a supplementary question.
Speaker, I want to remind the Minister and the Premier that 2.2 million Ontarians don't have access to a family doctor right now. And in Northern Ontario, we know the shortage is chronic, and it's going to get worse now. As these for-profit corporate clinics set up shop in more lucrative urban locations, it's going to be even harder or even impossible for smaller rural hospitals to recruit and retain the staff they need. That is what we are hearing from the front lines. You should listen to them. Northern and First Nations communities know that this government's plan to replace community-based care with private for-profit clinics is going to make their access to health care even worse. Speaker, to the Premier, why are you making it even harder for people in the north to get the care they need?
Minister of Health.
Now, Speaker, the NDP will continue to say the status quo is good enough. It's not good enough. We need to have people accessing care faster. And one of the ways that we are doing that is absolutely expanding the clinical and diagnostic piece. The other part is actually building out the health human resources so that, as an example, because of the passage of Bill 60, we have, as of right, in the province of Ontario, first Canadian jurisdiction to do so, which means that a physician practicing in British Columbia today can tomorrow start working in Ontario, because we know that we want to eliminate the barriers, eliminate the red tape to make sure that individuals who want to come here, who want to practice, who want to be in our world-class medical facilities have that ability without the many, many red tape barriers that we've seen in the past.
The final supplementary.
Speaker, the minister doesn't want to talk about the north, I guess. Let me introduce a concept to you. Highway health care. Highway health care is what happens when this government forces Northerners to travel long distances, sometimes thousands of kilometres away from their families to receive the health care that they need. The Northern Health Travel Grant gives them $100 for a hotel. Well, good luck finding anything for that price anywhere. And worrying about that when you're sick, just great. Speaker, to the Premier, if he's focused on destroying our healthcare system and more Northerners are going to have to travel even farther to get the care they need, will he at least enhance these supports?
Members will please take their seats. Minister of Health.
Is the Leader of the NDP suggesting that when we expand MRIs into new facilities, new communities in the north, in the south, in rural communities that have never had an MRI in their hospital before, that is status quo that you're happy with? It is not. Our government is making the changes that will ensure that people will get access in their communities. And one of the ways that we're doing that is actually integrating the healthcare system. Instead of having individual hospitals, individual organizations, we're making sure that those partnerships ensure that individuals who are on wait lists, whether it's for cataracts, hips or knee replacement surgeries, can get it in their community. That is what Bill 60 is about. It is about challenging the status quo, ensuring and engaging in innovation that is frankly happening across Ontario. We're empowering hospitals to do that. Thank you, Speaker.